In modern society, there are several causes of blindness all around the world. Among them, the most common disease that can be treated by surgery is a cataract. Many people with severe cataracts, which may cause blindness, still live in some areas of the world. In some countries, only ECCE is being carried out for cataract surgery to avoid the risk of blindness by many organizations or excellent ophthalmologists without advanced equipment at this moment. Even in hospitals equipped with advanced instruments, the outcomes of surgery using ultrasound phacoemulsification machine are worse than those of simple ECCE surgery, including severe corneal edema. In some countries, ECCE surgery is still mainly performed. However, cataract surgery instruments continue to be developed to reduce the surge phenomenon and to provide successful outcomes in a stable state by automatically controlling the intraocular pressure to maintain the pressure on the anterior chamber during the surgery. Phacoemulsification is still being used, but posterior capsular rupture or severe damages of corneal endothelium caused by ultrasound put doctors who perform cataract surgery in a difficult condition. In the case of cataracts with severe nuclear sclerosis, the cornea is always swollen on the next day after phacoemulsification is performed. In addition, the recovery period is long. Thus, sometimes doctors encounter difficult situations. We would like to propose a method which has been designed for a long time in order to reduce the risk of corneal edema by reducing the use of ultrasound and minimizing the damage of corneal endothelium during heart nucleus cataract surgery. When a doctor meets a rock heart nucleus or a black-colored nucleus during cataract surgery, it should be made as small as possible so the nuclei could be easily removed by ultrasound. However, these nuclei are not easily made into small pieces, and the posterior area of the lens is not easy to separate. Some doctors encounter such difficult situations. Therefore, it is required to have an instrument that can completely separate the lens while protecting the zonules and posterior capsules. The first one is the existing C pre-chopper, which is designed to reduce the number of surgical instruments and to make the lens into small pieces by using two functions such as continuous curvilinear capsulorhexis and pre-chopping. The second one is the CM hook that helps fully use pre-chopper power while protecting the posterior capsule, and that helps efficiently make the lens into small pieces. Of course, it is a hook that is used continuously during cataract surgery. The last one is the C-lens loop, which is designed to take out the fragmented hard nuclei. It has been designed to remove nuclei by using the small incision. Ultrasonic instruments, Alcon Centurion, Abbott Signature, BNL Stellaris PC are used. For the basic setting, aspiration is applied up to 600 mm Hg on the basis of the situation. Phaco power set to 30 and reduce the using time as possible. After C pre-chopper CCC, hook is placed on the rear of the lens and the hard lens is made into small pieces using C pre-chopper. Remove large lens nuclei using C-lens loop. Put the ultrasonic handpiece in the anterior chamber to remove the remaining part in the INA mode. If necessary, use ultrasound. CM hook is properly used to prevent lens capsule rupture and to effectively remove remaining lens cortex. If suction power is weak, the aspiration level is increased to the maximum. The most common complication occurring at the initial stage of cataract surgery using these three surgical instruments is the corneal endothelial contact during surgery, partial injury of the lens ligaments, and slight iris injury, such as iris fixation, are also common complications. However, there are no serious complications that would have a significant impact on the insertion of the intraocular lens or visual acuity after surgery. It is another surgical method that can reduce corneal astigmatism, an injury of corneal endothelial cells caused by a small incision window when extracapsular cataract extraction is performed for cataracts with severe hardness. During general cataract surgery, intraocular injuries caused by ultrasound can be minimized by reducing the use time of ultrasound and using it only for helping lens aspiration. However, more time is needed to get used to the movement of the 3 surgical instruments in the anterior chamber. Further studies are required for unusual situations such as extremely narrow anterior chamber, severe injuries of lens ligaments, and excessive myopia.